A 62-year-old female presents with jaundice, and these are the laboratory results. Clinical presentation and the laboratory results are consistent with what condition? Inherited factor 7 deficiency is not the correct answer because factor 7 is only involved in the extrinsic pathway, so it should not affect the APTT. DIC or disseminated intravascular coagulation is not the correct answer because although it causes prolonged PT and APTT due to consumption of coagulation factors, the platelet count will be decreased, so there will be thrombocytopenia and presence of schistocyte. Von Willebrand's disease is also not the correct answer because the hallmark of this disease is mucocutaneous bleeding due to quantitative and structural abnormalities of von Willebrand factor, which leads to decreased adhesion of platelets to injured vessels. There will be also normal platelet count except for type 2B and normal to slightly prolonged PTT. So the correct answer is cirrhosis of the liver based on the clinical presentation and laboratory data. These are most indicative of cirrhosis of the liver. Remember that most clotting factors are synthesized in the liver. Increase in multiple clotting factors is associated with prolonged PT and APTT. Also, in liver disease, macrocytosis and target cells are prominent. The liver's inability to change unconjugated bilirubin to conjugated bilirubin so that it can be excreted leads to elevation of total bilirubin and direct bilirubin, and jaundice is the clinical presentation. Liver enzymes, especially the transaminases ALT and AST, are also elevated.